We've talked about how much physical activity, what type of physical activity people need to get to prevent disease, promote health. But how many people in America are actually doing and reaching that level of physical activity? To find that information out, we want to go to another resource called Healthy People 2020, which are national objectives for achieving health promotion and disease prevention that are driving almost every public health initiative. So today I want to introduce you to those objectives as they relate to physical activity. I'll show you some of the great things available on this resource that can help you with class projects, not only this class, but future classes. So let's look at and find physical activity objectives for the America. Let's go to the tab. I just clicked 2020 topics and objectives. It takes us to an A to Z menu. And if you'll look, there is a physical activity link that we'll hit. This summarizes all of the objectives specific to physical activity, aerobic, and muscle strengthening. It not only talks about the objectives, but it highlights the proven interventions that have been evaluated and shown to effectively increase physical activity, not only for kids, adults, and the elderly, but people just living in their neighborhoods. There are things we can do related to our built environment and to the policies that drive our community. First, let's highlight the objectives. I just hit the objectives tab. There are 15 national objectives. And from this screen, you can see objective 1 is to reduce the proportion of adults who don't get any leisure time physical activity. Objective number 2 is to increase the proportion of adults who get physical activity, but we want to see them increase it to the level where they meet the federal guidelines for both aerobic and muscle strengthening. So I'm going to highlight objective 2.4. We want to increase the proportion of adults in America who meet both of those, aerobic and muscle strengthening. So let's just look at that and see where it takes us. It summarizes and tells us first baseline data in 2008 found that 18.2% of adults reported that they met both aerobic and muscle strengthening. The target for the year 2020 is to increase that proportion to 20.1%, which is really only a 10% improvement. But when we're talking about at the federal level, nationally, that's a fairly large public health target. The data itself comes from the National Health Interview Survey conducted by the National or Centers for Disease Control and the National Center for Health Statistics. It actually has a link to the data, which we'll highlight. It also has a link to the research articles related to that objective. And this is a resource and a real neat thing I want to show you. If we go to related research articles on PubMed, it takes us to another tab. PubMed, which is driven by the National Institutes for Health, has created a search engine with, you'll see the major search terms at the very top to highlight that particular 2.4 objective. There are 746 articles that have been published on physical activity on either aerobic, muscle strengthening, or both. And if you wanted to find research articles, and you will be tasked with this frequently throughout our course, this may be the way that you want to go find those articles for your papers or your discussions. I actually used reference number 9 or notation number 9 titled Relation Between Physical Activity and Public Transit Use. I used it on a paper recently in terms of if people use mass transit. We found, and this study actually shows, that people increase their walking just going to the metro or going to the bus station or the train. So communities who have a nice public transit system typically see a higher proportion of adults meeting those federal national guidelines for physical activity. Let's go back to Healthy People. Okay. Now I want to go up and just show you very quickly the interventions and resources. We hit that tab and you'll note that it says evidence-based clinical recommendations, which many of you all going to the health sciences may be interested in, and then information for consumers. Let's look at the evidence-based resources. And actually, it just kept us on the same page. That's fine. Let's look at the very first one, obesity and obesity control and prevention, behavioral interventions to reduce screen time. This is a focus, especially for children, school-age children, in terms of we would like for them to not get as much TV time. We'd like to replace it with physical activity or play. And this particular link takes us to a summary of those types of interventions that reduce screen time that are then related to positive weight-related outcomes. And it gives us a very quick link to the particular resource we want to go to and gives us just an overview. So if I were wanting to target that as an intervention, this would be the place that I could very quickly find out information related to that. The national snapshot and national data also give, especially physical activity epidemiologists, a way to very quickly figure out where we can access data and how that data is being collected by the federal government. Because oftentimes when we're looking at local communities, we can go to these data sources, find the methods, find the surveys, and we can use those in our local evaluation and surveillance activities. When I was working with the Knox County Health Department in Knoxville, Tennessee, as their chronic disease epidemiologist, I often referred to these links to find surveys for telephone interviews, telephone surveys, or paper surveys in terms of helping me measure the health status of Knox County adults and children. So this is a really nice epidemiology related surveillance type of resource that I use fairly frequently. The going back to the homepage for Healthy People 2020, I encourage you to bookmark this as a resource for the class and for your future classes and your future career, because this is the one resource I use. It's probably the most frequently used resource that I have cited and refer to. It's one of the top 10 bookmarks for my web browsing. So I hope you'll use this in the class, and I think you'll find it very, very helpful.